Think about the intensive care unit, the ICU. It's got to be one of the most advanced, high stakes environments in all of medicine, right? Every single patient is monitored constantly, and that generates this absolute flood of data: heartbeats, oxygen levels, lab results, you name it. But what if most of this potentially life saving information is just going to waste?
And the scale here, it's just staggering. In the United States alone, intensive care costs over $81 billion a year. To put that in perspective, that's more than 4% of the entire country's health spending. We are pouring huge resources into gathering all of this data.
So that brings us to the big paradox we're digging into today. With this absolute wealth of information, why aren't we seeing even bigger breakthroughs in patient outcomes? Why is it so hard to turn this data deluge into actual life-saving insights? Well, it really seems to boil down to three core challenges.
Okay, so what are we up against? The problem really breaks down into three key areas. First off, the data is locked away. Second, even the data we can get our hands on is often messy or just plain wrong. And third, the system we're trying to understand, the human body itself, is unbelievably complex. Let's break each one down. So let's start with that first massive hurdle, locked data. The information we so desperately need is often trapped in what the experts call data silos. The technical term for this is compartmentalization. Just picture it. The ventilator that's helping a patient breathe is made by one company, the ECG machine monitoring their heart, totally different company. The lab system has their blood results, and the electronic health record has the doctor's notes. And here's the kicker, these systems almost never talk to each other.
So, why does this even happen? Well, it's a mix of, good intentions and just frustrating realities. You've got strict privacy laws like HIPAA, which are absolutely crucial for protecting patients, but they also create barriers to sharing data for research. Then you have the technical hurdles. There are over 200,000 medical devices registered in the US, and there's no common language for them to speak. And honestly, competition between manufacturers doesn't give them a whole lot of incentive to make their devices play nicely together.
Now, you might be thinking, hey, didn't electronic health records fix this? And it's true, we've seen a huge jump from less than 10% of US hospitals using them in 2008 to over 75% just 6 years later. But this chart shows the problem perfectly. Collecting the data is one thing, but if it all stays locked away in separate, incompatible systems, you just can't get the full picture of the patient.
But the problem doesn't stop there. It just builds. Because even if you could unlock and integrate all that data, you'd immediately slam into the second major challenge: the information itself is often dirty. And this is so important to remember. This data is collected for one main reason: immediate patient care. It's not collected to be perfect and clean for some analysis down the road. So a nurse might jot down a quick note to explain a weird reading, which is super helpful in the moment, but it creates a total mess for any algorithm trying to analyze that data later. And to really get the scale of this problem, check out this unbelievable statistic. Because all those monitors are tuned to be extra sensitive, they can generate false alarms up to 95% of the time. That is a perfect example of erroneous data just overwhelming a system. And this is way more than just an annoyance. It leads to a really dangerous thing called alarm fatigue, where the clinical staff, who are only human, get desensitized to all the constant noise. And that's when a truly life-threatening event can get missed. The dirty data has real life or death consequences.
So when researchers dig in, they find this dirty data comes in a few different flavors. You've got just plain erroneous data, like a sensor getting bumped. You've got missing data, which often happens because a doctor decides a test isn't needed, which, by the way, is its own piece of information. And then there's imprecise data, where we use things like billing codes that don't really capture the full clinical picture. Okay, let's just imagine for a second we've solved those first two massive problems. We have all the data, and it's perfectly clean. We now face the third and final challenge, and honestly, it's the biggest one of them all: the incredible complexity of the human body. We are trying to model the most intricate, dynamic system on the planet. Every single patient is unique, their condition is changing by the second, and thousands of variables are all interacting in ways we're just beginning to understand. Getting a handle on all of that is the ultimate hurdle. And this is exactly where machine learning shines. ML algorithms are designed to sift through exactly this kind of overwhelming complexity. They can spot these subtle, life-saving patterns across thousands of data points, patterns that are literally invisible to the human eye. And we're not just talking theory here. The promise is super tangible. We're talking about real-world breakthroughs, like more accurately predicting patient outcomes, helping to cut down on all those false alarms we talked about, and even estimating vital signs that we can't measure directly, like cardiac output. But one of the most exciting areas has got to be personalizing treatment. Let's take medication dosing as a perfect example. Traditionally, it's based on general things like a patient's weight. But with a machine learning model, you can create a truly personalized policy. One study showed how ML could learn the perfect dose of a blood thinner just by looking at a patient's unique data, and it totally outperformed the standard hospital protocol. This is what precision medicine looks like in action.
So, after walking through these three massive, messy challenges, what's the path forward? How do we actually get from this data deluge to deeper, life-saving insights? Well, the journey forward pretty much mirrors the problems we just laid out. First, we have to unlock the data by breaking down those silos. Second, we need really good methods to clean and make sense of the data we collect. And only then can we bring in these powerful machine learning tools to truly understand all that complexity. And you know what? Experts in the field are all saying the same thing. The single biggest roadblock in our way is that very first step. They say the major barrier to better care is the lack of an integrated, openly available data warehouse. Now, projects like the Mimic database are a fantastic step in the right direction, but there is so much more work to do. Which leaves us with this final massive question. The algorithms are here, the computing power is here, but to truly revolutionize medicine and turn all this data into cures, we might first need a revolution in how we share it. Will making data open and accessible be the real key that finally unlocks the future of care?